oh boy, is the weather hot where you are? Because it is where I am. But I guess this is summertime in the western United States. Anyway, welcome back to Noggin Notes. You didn't tune in for a weather report. You tuned in to help enrich your noggin on all sorts of matters related to mental wellness. And today we're talking about geriatric care, as well as a really cool endeavor called Project Echo. Project Echo is something that I participated in for the last couple of years through the University of Nevada. And I'm going to let our guest, Mordechai Lavi, talk about what Project Echo is, because he literally oversees it at the University of Nevada. It's not just in Nevada, it's all across the country and in 30 different countries not named the United States. So if you're listening to this internationally, I would really recommend that after you hear Dr. Lavi talk about what it is, that you go seek out your own education as well through the Project Echo program. And you can find out stuff like that in our show notes. Anyway, thanks for listening. As always, our sponsors are Zephyr Wellness. Find out zephyrwellness.org. I guess find out more at zephyrwellness.org. You won't find out zephyrwellness.org. That makes no sense. Geez, teach people to communicate for a living, and I can't even talk into a microphone. Anyway, zephyrwellness.org. That's our mental health outpatient agency in Northern Nevada. We're really proud of what we're doing here. Go there, find new stuff. We're always producing new content like podcasts and YouTube videos and posting inspirational things on Instagram. We're also sponsored by Audible. And if you don't know about Audible's totally unmatched selection of audio content, you should go to audibletrial.com/nogginnotes. Help us out by signing up for a free 30-day trial and getting a free audiobook with your 30-day trial. You get to keep the audiobook even if you cancel. And it's a great way to expand your knowledge base. And like I've said before, if you're listening to a podcast, then audiobooks are probably right up your alley. Listen to you while you drive, while you're mowing the lawn, making dinner, telling your kids to pick stuff up and put it away. Anything you can think of that goes on a mobile device and has headphones, you could probably put an audiobook on it. So check out Audible, audibletrial.com/nogginnotes, and give us your support. Without any further delay whatsoever, this is my interview with Dr. Mordechai Lavi on the Noggin Notes podcast. Enjoy. Well, listening audience, on this episode of Noggin Notes, we are interviewing Dr. Mordechai Lavi, who is a medical doctor here in town in Reno, Nevada. And he also works at the University of Nevada School of Medicine, and you wear a few hats. I'll let you introduce yourself, and then we can go from there.
Cool. Thanks, Jake. Appreciate you having me today.
Yeah, thanks for being on.
Yeah, no problem. So again, my name is Mordechai Lavi. I'm a practicing geriatrician in town. For those of you that aren't familiar, a geriatrician is a physician or a doctor that takes care of elders and the common things that happen to you as you get older. So I specialize in all of those things. Love hanging out with my patients and the people that also like to take care of elders. So that's kind of my practice. I do work through the University of Nevada School of Medicine up here in Reno. And like Jake said, I do a couple other things. One of the other things is I'm currently the medical director of Project Echo. Echo is an acronym that stands for Extensions for Community Healthcare Outcomes. And essentially, it's a telehealth platform that connects providers to providers across the state or across geographical barriers or just physical barriers. So a great way to kind of improve healthcare capacity and create a community of learning through telehealth. And I'll be talking about a little bit more about that today as far as kind of how Echo started, because Echo isn't only here in Nevada, here in Reno, it's really all over the world. And so I'll kind of share with you how it started in New Mexico, then move into kind of more of what we're doing here at Project Echo Nevada, here in Reno, all of the partners that we have. And if there's more time after that, we'll kind of move into other things.
Yeah, and I appreciate you saying that. That's actually exactly why I had you on. Because Project Echo is something I've been participating in as a clinician practitioner for a couple of years now, and I found a great deal of value and merit. It's very enriching, and I think more people need to know about this wherever they are, because that's what we aim to do. We aim to bring knowledge and information through this medium, this podcast, so that people can enrich their lives and become more educated. So yeah, I mean, tell us, like, how did it start and how did it come to Nevada, and what's your role and all that?
Cool, yeah. So I've only been with the Project Echo here in Nevada for almost 2 years. Project Echo in Nevada has been around since 2012, but Project Echo was first kind of solidified in that evidence back in 2011 when Dr. Sanjeev Arora, a hepatologist down at the University of New Mexico in Albuquerque, essentially started the first Echo model, or first Echo clinic rather. That one was dealing specifically with hepatitis C. So the way Dr. Arora kind of came up with the idea of an Echo clinic was he was like a lot of other providers in the early 2000s, had his own hepatitis C clinic. He was an academic medical center. His wait lines for his clinic were up to 8 months at a time. And so patients with hepatitis C would get worsening liver disease as they waited to see him. People would die of infections, people would die of bleeding, people's livers would just get more unhealthy, and the variety of things that can cause. He felt that if he could just seen these patients sooner, started them on treatment, potentially their outcomes could have been different. So he was wondering why all of these rural providers in New Mexico were referring to him rather than treating the patients with hepatitis C themselves. So essentially he went on a rural road trip, went to 21 different rural sites and prisons in New Mexico, found out they just felt uncomfortable with the hepatitis C treatment at that time. This was before Gilead came out with Harvoni, essentially the hepatitis C drug, or the hepatitis C class of drugs that we use nowadays that work really well in a short time frame and have good results. This was when we were still using interferon, ribavirin. These medications have a lot more side effects, aren't as well tolerated. So providers kind of understandably in rural New Mexico just didn't feel comfortable with the medications and kind of helping treat their patients through the cure of this disease. So what Dr. Arora offered them was essentially what is now known as the Echo Clinic. He offered them twice weekly Echo sessions where the providers in these 21 different sites in rural New Mexico would log on via Zoom, just like Jake and I are now, and they would essentially hold an Echo Clinic. The Echo Clinic had two main parts. The first part where the rural clinicians would present cases of patients with hepatitis C to the experts that Dr. Arora had assembled at the University of New Mexico. That team of experts included himself, a hepatologist, an infectious disease doc, a pharmacist, and some other community partners, and a psychiatrist too. And they would kind of help counsel through the side effects and the treatment for the patients in rural New Mexico to kind of get treated as the providers help treat them for their hepatitis C. He was able to publish a paper about this Echo Clinic in the New England Journal of Medicine in 2011, showing that the outcomes for the patients treated by these rural providers participating in the Echo Clinic were equal to that of patients treated at the university. And so it was kind of a land-breaking kind of article as far as a potential new model to increase healthcare capacity, especially when distance can be a barrier.
So to complete the picture, I mean, we have some clinicians who listen to this show too. Think of like staffing your case with a colleague or with a supervisor if you're an understudy, an intern, or a whatever. You go and you present and you go, hey, I got this patient who's exhibiting these things. Here's the demographic data. What do you suggest? Well, what Echo does is it takes this concept and puts it virtual, right? So we can reach more people through telehealth. And then we have a panel. So it's rather than just like one supervisor staffing cases with a bunch of interns, what you do is you invert that. You got multiple quote unquote supervisors, and that's the panel of folks you mentioned. And one or two cases will get presented, and then people take away information and go implement it in their clinical execution and make Earth better, so to speak. There's also a didactic portion to the ones that I've always attended. Talk a little bit about that too.
Yeah, exactly, Jake. I think you pointed out a lot of the real nice attributes of the Echo model. Not only are you getting that information from the experts, you're also getting information from the other people participating in the Echo Clinic, and so it really creates a community of learning where not only are you learning as somebody kind of presenting the case to the group, but they're also learning from you as you kind of share things that have worked well for you, things that haven't worked well, and kind of talking through the pros and cons of different approaches. And so Echo model really creates that community of learning. And then the other one I just kind of want to emphasize before I kind of answer your question more specifically, Jake, is the force multiplier. As you kind of learn how to kind of approach that patient with that specific disease process by participating in an Echo Clinic, you're not only able to apply that knowledge to that one patient that you reviewed with the group, you can apply that knowledge to your whole panel of patients. And so it really increases healthcare capacity in that respect. Because now you don't only know how to treat that one patient with hepatitis C, you can probably approach multiple patients with hepatitis C and be successful in their treatment.
Right, absolutely.
Sorry, Jake, what was that?
Oh, I just said, yeah, absolutely. I was just agreeing with you.
Yeah, so yeah, I appreciate those examples, Jake. I think that just really highlights those two great attributes of the ECHO model. Because ECHO is really about learning and increasing healthcare capacity, we're also a CME platform. And so all of our ECHO clinics have didactics. That's really the secondary way that we learn via an ECHO clinic. The primary way is talking about cases, but we always want to make sure that we're learning more through the ECHO clinic. So our subject matter experts often have a didactic dealing with a specific subject. In the hepatitis C clinic, they would talk about a different attribute with regard to hepatitis C, whether it be a drug or a side effect, or the hepatitis C virus itself with regards to diagnosis or pathophysiology. In our current ECHO clinics, it really depends on the topic at hand and what they want to talk about. So the didactics, again, are really important. People really come for that CME initially when they hear about ECHO, but they often stay for the cases in that community of learning that we try and develop.
And for the listening audience, CME stands for Continuing Medical Education. Most licensed providers have to meet a set of criteria in order to renew their licenses. So you may hear this referred to as continuing education hours, CEH, or continuing education units, or if you're in the legal field, it's continuing legal education. But the idea is that you have to attend a certain number of courses over a year or 2 years, however long it is that you need to renew your license. And then you present that to your licensing board and say, I have maintained my competence. And this is one of the very excellent ways to do that. So part of didactic, for people who don't know that term, what it is you get taught. It's just a static presentation. Somebody goes through a PowerPoint, or they give some sort of knowledge, and then the audience participates along. And so there's multiple ways of learning from this. Where else is ECHO located? It started in New Mexico. We know it's in Nevada. I've seen people come in from California, Colorado, Idaho into our ECHO clinics. I don't know if they're just like parachuting in, or if they actually have ECHOs established in those states as well.
Yeah, so Dr. Aurora published this article in New England Journal of Medicine in 2011, and after that, ECHO really caught on like wildfire. We're just right now June 2020, and so right after we heard New Mexico published the paper, Chicago jumped on quickly after that, applied it to a much different audience than rural New Mexico, applied it to treating African-American patients with hypertension, showed good results with that. Nevada was one of the early adopters. Dr. Evan Class, he was an endocrinologist here at the university, was initially the person that brought Project ECHO Nevada to the university back in 2012 and kind of served as the medical director until he retired, and I took over that role about 2 years ago. But after Nevada picked it up again, it just continued to spread like wildfire. Currently, an ECHO program is in 48 different states, over 30 different countries all over the world. And as ECHO has expanded and really kind of exploded, it's turned into a movement. And so not only do we kind of have the ECHO model and the ECHO facilitation with the case-based learning with the didactic that kind of Dr. Aurora initially described in his initial paper, it's really turned into creating a bigger community to kind of help disseminate knowledge and increase healthcare capacity, just because the world is so big. And thankfully, in a lot of ways, it's a lot easier to communicate via technology for a lot of us. Still not for all of us. And so I think there's still some work to do there. But for a lot of us, we have the ability to communicate via technology much easier. And the ECHO model really, really highlights that, and its ability to spread all over the world has been great. As this ECHO model has expanded, the University of New Mexico really wasn't able to train all of the different ECHOs like they trained Dr. Class when he started his ECHO in 2012. So they've had to create this concept, what they call super hubs. So essentially other types of ECHO networks that can train other ECHOs to become ECHOs. And so there's super hubs all over the world. A couple ones I'll highlight is one in the UK. This is a super hub specifically dealing with hospice and palliative care. And so essentially symptom treatment and end-of-life treatment. Essentially, if you have an ECHO that you're thinking about starting with that respect, they're a great resource to look to. Also have a super hub in India where they deal with a lot of different other things besides the things that we deal here with in Nevada, lots of similarities too, but also things like water sanitation. They have ECHOs on prenatal care. I think we could benefit from those here in Nevada, but they have those in India. And so ECHOs are really diverse all over the country, really do their best to fit the needs of the communities that they're in.